Hi, my name's Carmen Robinson, and I'm a Georgia Highlands College BSN student. And today I'm going to be performing a head-to-toe assessment for my Week 7 assignment. This is Kevin. Kevin, today I'm going to be doing a head-to-toe assessment. I'm going to start from the top and work my way down to the bottom. If you have any questions during the process, just let me know. I'm going to be asking you to stand, sit, turn certain ways. So just let me know if anything's uncomfortable, okay? And now I'll go wash my hands. Okay, Kevin, we're ready to get started. The first thing that I do is assess for level of consciousness with a patient. And to do that, I'm going to be asking certain questions directly. So can you state your name for me?
Kevin.
And do you know where you are today?
In Waco, Georgia.
And can you tell me what year it is?
2015.
Okay. During this process, I'm going to be assessing for fluency of speech, clarity of speech, and then we move forward. Okay? Next, I'm going to have you sit up straight, put your arms back for me, and I will assess the head. During this process, I'm just going to be looking at hair distribution, size of the head, shape of the head, just making sure that everything, there's symmetry there. Okay? And next, we're going to assess your face. And during this time, I just want to look at color, make sure that there's symmetry there as well. And we are going to be looking at, the eyes, the nose, the mouth, and all that independently. So first of all, we're going to test cranial nerves 5 and 7. So first, we're going to test cranial nerve 7. And if you'll smile for me, show me your teeth, blow out your cheeks. And if you'll close your eyes really tightly for me. Great. Okay, that is testing cranial nerve 7. And then we'll move on to testing cranial nerve 5, and that is with sensation. So, Kevin, I'm going to take a cotton ball, and I'm going to have you close your eyes, and I'm going to touch you in certain places, and you just let me know where I touch you, okay?
Left cheek.
Okay.
Forehead.
Okay.
Left cheek. Chin.
Okay, good. Everything seems normal. Next, I'm going to be assessing the eyes. And we're just going to be looking at shape. We're going to be looking at, how they're proportioned to the face. And looking on the external at the eyelids, the eyelashes, just making sure that everything, checks out with it. And we're going to go to pupillary reaction to begin with. So I'm going to take my pen light. And Kevin, we're going to dim the lights. Can you dim them anymore? Let's see. Okay. I'm just taking my pen light and I'm starting from the outside of each pupil and moving my way in. All right, and everything looked normal. For normal with pupillary reaction is constriction of the pupils, and he did that. And next we're going to test for accommodation of the pupils. Let me get my light back on. And this accommodation of the pupils is when you start from a distant point and you go in. So Kevin, if you will, just focus on this wall for me. And I'm going to use my pen light, it's turned off, about 12 inches away from the patient, and go in. Good. All right, everything looks normal. We have convergence of the eyes and constriction of the pupils as well for that test. Next, we're going to assess the ears. And at first, we're just going to look at the ears. We're going to look for any lesions, rashes. We're going to make sure that the skin is the same color as the face. If there's any discolorations whatsoever, we would note that. And I'm going to palpate the auricle, palpate the mastoid process, And Kevin, do you have any tenderness there?
No.
Okay. Have you noticed any changes in your hearing, such as having to turn up the TV, anything like that?
No.
Okay. After that, we're going to move on to the nose. And we're going to do the same with the nose. We're going to look for symmetry. We're going to look for color. We're going to look for lesions. And then we're going to palpate the nose for tenderness. Any tenderness?
No.
Okay. All right. And has anything changed as far as your sense of smell?
No.
Okay. And we are going to do now patency of airflow. So if you will, just take one side and take a deep breath. Now with your right hand. Okay. Now if someone came in for any sinus issues, we would actually then do an internal inspection of the sinuses, and we would palpate those sinuses, and we would transluminate them to make sure there wasn't any secretions or any fluids or anything of that nature. All right, now we're going to move on to the mouth. Let me get my gloves. And for this, I'm going to need a tongue depressor and my pen light. Have you noticed any changes with your sense of taste?
No.
Okay, if you can open up your mouth for me. What you would do here is you would identify a number, how many teeth, what condition they're in. You would look at the buccal mucosa and make sure that everything's intact. If you have any lesions, any sores, anything like that. So, Kevin, if you will, let me get my pen light on. Can you say ah for me?
Ah.
All right. The uvula is normal. And you said no changes with your sense of taste, correct?
Right.
All right, and you would document all of that. So let me take my gloves off. Dispense of those. And we're going to move on to the neck. We would palpate the neck. We would look at the same thing. We would look for color. We would look, for symmetry. We would look for any lesions, any rashes, anything like that. And we can then palpate the thyroid gland. And the thyroid gland, as a landmark, you can use your index finger and your thumb. Normally, the thyroid gland is not palpable unless it's enlarged. So it's just like the lymph nodes. Unless it is enlarged, you really can't feel it. But if it is enlarged, then you would use your stethoscope and listen to it with the bell of your stethoscope for any bruise. So same goes for the carotid arteries. We would palpate the carotid arteries, but we wouldn't palpate but just one side at a time. If you did both sides at the same time, then you would decrease cerebral blood flow. So we do one at a time, and then we would actually listen to the carotid arteries with our bell of the stethoscope for any bruise. So if you can hold your breath for me. Okay, I don't hear any swishing, any wheezing sounds. Everything seems to be normal. And now we are going to move on from that. We've got all of that assessed as far as your upper area. We're going to go on to your arms, hands, and your fingers. Okay? So if you'll stand up for me, we'll put the chair back just a little bit. I'm going to inspect, let's see, let's move over here just a little bit. Are you in the camera still? Wait, let's move this way. And then I'll just point it out to me. Okay, we're going to inspect your arms, your hands, and your fingers. So I need you to bring your hands together for me. Raise them above your head. Put them down. And come back for me. All right. And then we're going to test your muscle strength. So if you'll just push against me for muscle strength. Great. Then I'm going to check for capillary refill. Pink color is prompt. There doesn't appear to be any cyanosis. All right, and we're going to do range of motion of the fingers. So if you will, just open and close your fingers. Can you move your thumbs for me? Okay, great. Now, if you will just have a seat for me, and we're going to do range of motion as well with this, rapid alternating movements. So put your hands here, your palms, and turn them over, and just increase the speed as you go. Perfect. Now, palpation of pulses. We will palpate the radial, the brachial, and the ulnar. Radial, strong pulse. The brachial, and the ulnar. Same arm. The radial. Got a strong pulse. You feel it? The ulnar. And the brachial. Okay, great. We're going to test for sensation with your upper extremities, and we're going to do just like we did before. I'm going to have you close your eyes, and I'm going to touch certain spots, and you tell me where I'm touching, okay? So if you'll just close your eyes for me and let me know where I'm touching, okay?
Left forearm.
Okay.
Forehead. Left hand.
Okay.
Right hand.
Good. All right, and now we're going to just keep your eyes closed, and I'm going to do your fingers, and just tell me which finger that I pull up, okay?
Left finger.
Which finger?
Beside my pinky.
Okay.
Pointing finger on my right hand.
Okay.
Pointing finger on my left hand.
Okay. All right, and now we're going to move on to the posterior and lateral thorax. So if you will, just turn around for me, and we're going to expose just your back, okay? And you can move over here so we can get you better. And I'm going to pull up your shirt. Okay, have you noticed any difficulty breathing, any shortness of breath, coughing?
No.
During this time, I'm just going to be inspecting the posterior lateral thorax. We're just looking at, the scapulae, the curvature, the configuration, just inspecting at this point. And you say that you have no difficulty breathing, shortness of breath.
No.
Okay, and next we're going to palpate. We're going to palpate for tenderness. We're looking for any masses, lesions, any kind of sensations like that as well. So first we're going to palpate for crepitus. And crepitus is when air gets into the tissues and it sounds like a crunching sound. So I'm just going to palpate. Okay, and then we're going to check for fremitus. And by doing that, when I place my hands down, I want you to say 99, okay?
99.
Good. All right, and next we're going to check for chest expansion. And this is level T9 or T10. And your hands should move roughly 5 to 10 centimeters apart when the person takes a deep breath. So I'm going to place my hands in the area T9, T10. Take a deep breath for me. Okay, one more time. All right, and that's chest, checking for chest expansion during that time. All right, now we're going to percuss. Now, over the lungs, you should hear a resonant sound when you're percussing, and then after we percuss, we'll auscultate. Kind of doing a zigzag pattern here. All right, and then we're going to auscultate in the same pattern that we did before. We're listening for any wheezing, any crackling, pleural friction rubs during this time. Kevin, you can put your shirt back on, and we're going to look at the anterior, the front portion now. We're going to do the same thing. If you'll just pull your shirt up for me. We're going to do the inspection. We're just going to look, for lesions, any discoloration. We're going to look at the configuration, the slope of the ribs. Basically the same thing as the posterior, but we're on the anterior now. After we inspect, we're going to palpate again. And we're just going to palpate for any tenderness. And when I put my hands down, if you'll just say 99 for me.
99.
Okay, great. And we're going to percuss. Same way we did before on the posterior. Okay, and then we will auscultate. All right, everything sounds clear. You can put your shirt back if you'd like. Now we're going to move on to the cardiovascular. So I'm going to have you lie down for me, please. During this time, we are going to assess the heart. We're looking for any pulsations, and we're going to listen to the heart as well. So we're going to check for any visible pulsations to begin with. Let me move this camera just a little bit. Okay, so after we inspected for any visible pulsations, we're going to actually palpate for any pulsations. So we're going to palpate in the apical or mitral area. And then we're going to move on to the base and the left sternal border. So we palpated all of those pulses, and we don't hear any abnormal or feel any abnormal pulsations or vibrations. And we're going to auscultate the apical impulse. Okay, good. After you do a cardiovascular assessment, we're going to move on to the actual abdominal assessment. So just keep your hands down for me. We're looking for any discoloration, any striae. We're looking for any pulsations. Note that the umbilicus is here, and the aorta is right above the umbilicus. We see that the umbilicus is midline. So the actual abdominal assessment is quite different from the other assessments or the areas of the body, because you don't want to disrupt bowel sounds. So we are going to inspect, and then we're actually going to auscultate next instead of palpating first. When you're auscultating for bowel sounds, you should hear approximately 5 to 30 in each quadrant. So that's why you don't want to percuss first, because you want to be able to hear those. And it'll be gurgling sounds. You do this in each quadrant. Okay, sounds good. And now I'm going to auscultate the aorta. You would do that with the bell of the stethoscope to listen for any bruits. Again, it's above the umbilicus. Now we're going to percuss all 4 quadrants. Usually you would hear a tympany over the stomach, And then it'll sound a little more solid once you get over the solid organ. So we're going to percuss in all 4 quadrants. It's a different sound, wouldn't it? Okay. All right. And then after we percuss, we're actually going to palpate lightly. We're looking for resistance. We're looking for anything abnormal that you would feel within the quadrants. Okay, very good. You can pull your shirt down for me. Now let's look at the lower extremities while we're here. And we're going to assess the joints of your hip first. So if you will, just take your left knee and pull it up to your chest. Right knee up to your chest. Okay, and let's just go ahead and I will check for capillary refill with the toes. Everything's prompt return. Appears to be no cyanosis. And can you move your ankles for me? And move them out. Okay. All right. Let's see. After we assess that portion, we're going to assess the pulses now. So we're going to do the femoral pulse. And just cover this portion up while I assess. Okay, nice and strong. Let's cover you back up. And we're going to move on to the other pulses. We did the femoral, and now we're going to move on to the popliteal. And you get deep behind the knee to feel this pulse. Feel it? You have to get right into the crease. Okay, next is the dorsalis pedis on top of the foot. And the posttibial. This is on the back of the ankle. We've checked all the pulses, and we're moving on. We've done range of motion with your feet and your legs and your upper extremities. We've done the capillary refill, and we're going to now do light sensation, as though we've done with every other part of the body. So I'm going to take my cotton ball, have you close your eyes again. You just tell me where I'm touching you, okay?
Right foot. Left knee. Left knee again.
Okay.
Left foot.
Okay. All right. If you want to go ahead and sit up for me, you can. Now, I don't have a tuning fork with me today, but if I did have a tuning fork, this is how I would assess for hearing loss. I would take my tuning fork and vibrate it, and I would put it midline on Kevin's forehead, and he should hear the sound on both sides evenly. And if it's not, then that's, it will let you know that there's some type of hearing loss. That is actually the Weber. The Rhine is when you vibrate the tuning fork, put it on the back at the mastoid process, and Kevin would cover up his other ear, and he would let me know when the vibration stopped. I would do it again, put it close to the ear canal. We'd do the same thing. He would let me know when the vibration stopped. A normal or positive rhyme would mean that it was longer with air instead of bone, and that's positive. Okay, if you'll stand up for me, and if you'll just turn around like you're touching your toes, pull your shirt up. I'm going to look at spinal curvature. I don't see any abnormalities with the spine. Stand up for me and take a brief walk around the room. I'm going to be, assessing ambulation during this time. Perfect. Okay. Then we're going to do what is called the Romberg test. I'm going to need for you to put your hands straight out by your side. Okay. And close your eyes for me. And open them back up. Okay. Take your right hand and touch your nose. Left hand touch your nose. Now close your eyes for me and do the same thing. Right hand and left hand. All right. And I just want to make sure with your neck again, if everything, you've got complete range of motion. So if you will, just touch your ear to your right, ear to your left. Okay. Go back to the ceiling and down. All right. And with your arms, if you can just put your right over, left over, put them up and down. Okay. All right. I think everything checked out great today. Thank you so much for your patience. And this completes my head to toe assessment for my week 7 assignment. Thank you.